Hi, everybody. This is Linzie Bugg, your friendly neighborhood nurse surveyor. Welcome back to the Qsource Podcast, your go-to resource for everything related to LTC and the well-being of both residents and staff. So today, we are digging into something absolutely foundational to high-quality care. So staff health and safety in nursing homes. Because here's the truth. When staff feel safe and supported and well-equipped, they're not just doing a job. They're able to provide the very best care for the people who need it the most. So let's talk about the risks, the challenges, and most importantly, the solutions. What are the hazards that staff face? Working in a nursing home is deeply rewarding work, but it also comes with real risks. So let's break them down. First up, musculoskeletal injuries. So every day, staff are lifting, transferring, and repositioning residents. And without the right tools and techniques, that strain adds up and often in the back and the shoulders. I have many CNA and nurse friends that have lasting back pain because of attempting to move residents without lifts, reposition the residents without assist when they're two or more, when it's required to have two or more because they were short-staffed or crazy busy. It's just not worth it. Go get your DON, your admin, or other administrative coworker. Anybody that's available that's allowed to complete CNA tasks, go get them because it's really not worth it to hurt yourself. It could be a lifelong injury. Next up is exposure to infections. Whether it's respiratory illnesses, bloodborne pathogens, or seasonal flu, staff are on the front lines. So, for example, 18% of unvaccinated healthcare personnel will get influenza this year. And during resident outbreaks in facilities, this number can be anywhere from 5 to 40%, just depending on the resident population and the area that you're in. Next is workplace violence. And yes, we need to be honest about this. Verbal and even physical aggression from residents or family members is a real concern in LTC settings. In my almost 17 years of healthcare, this has been one of the most understated problems that sometimes flies under the radar. And recognizing the seriousness of resident and family aggression, understanding its root causes, and implementing proactive, evidence-based interventions are crucial steps towards creating a safer, more positive environment in LTC. Next is environmental hazards. So think wet floors, loose carpeting, or poor lighting. Simple things that can cause serious slips, trips, and falls. Implementing prophylactic measures to mitigate these hazards really is key. Chemical exposures. So cleaning supplies, medications, and other substances can pose hidden risks if they're not handled carefully or locked up. Exposure can lead to skin and respiratory issues, burns, other health problems, especially for individuals with pre-existing conditions. And our residents usually do have many, many different pre-existing conditions and comorbidities. And finally, the emotional toll. So this work is really demanding. Stress, fatigue, and burnout are not just part of the job. They affect both staff well-being and resident care. So mental health issues, turnover, and reduced quality of care are directly related to the environment that we work in. That makes it really important. We need to pay attention to these areas. How do we tackle these challenges head on? Let's talk about proven strategies. So up first, safe resident handling. Using mechanical lifts, gate belts, and proper transfer techniques. But remember, it's not just about having the equipment. It's about making sure that it's maintained and that staff are trained to use it correctly. I remember a survey that I completed years ago as a surveyor, and the complaint that I went in on, staff had dropped a resident from a lift. Come to find out, one of the CNAs was new and had not had the appropriate orientation and competency checks. And they didn't latch the sling correctly on the little, they look like clips. So I guess they didn't latch it on the clip correctly. And the resident fell over 5 feet to the floor. This resident did end up passing away. The facility, at least in this example, was responsible. The training that we give to staff can save lives. And that's just one example. Training the staff that come into your building should be priority as it's directly connected with resident care and satisfaction. Not to mention it could save a life. Important. Next is infection control. So the basics saves lives. Hand hygiene, PPE, vaccinations, and quick reporting of suspected infections are all really simple but effective things that we can do in the nursing home. Simple steps that prevent outbreaks. It really, really is that simple. Workplace violence prevention. So we want to train staff in de-escalation techniques. and create clear reporting procedures. And most importantly, we want to foster an environment where staff feel safe to speak up. I don't know how many times in my surveying years I heard that staff were afraid to tell the administration something. They should never be afraid to tell you anything unless they've absolutely done something, on purpose, horrible to a resident. They should not be afraid to tell you anything. You should have an open door policy, and these people should be able to come to you because they're your staff and they're caring for your residents. And I know people say this, we really are a family. We're a family in these LTCs. You work with these people every single day, sometimes for years and years and years. We have to take care of each other. By implementing these strategies, nursing home employers can create a safer workplace for their employees and minimize the risk of workplace violence. So ergonomics. Adjust chairs, workstations, and workflows to reduce strain. Teach staff how to avoid awkward postures or repetitive movements that can cause injury over time. By implementing ergonomic principles, facilities can reduce the risk of these musculoskeletal injuries and improve staff well-being and enhance overall productivity in general. You want to build a culture of safety. So leadership has to set the tone, encourage that open communication, provide regular training, make safety everyone's responsibility. By consistently implementing these strategies and fostering a culture of trust and transparency, nursing homes can create a safer, more supportive environment for both residents and their dedicated staff. Incident reporting. Create an easy, non-punitive system for reporting near misses and injuries. Then act on the information to prevent it from happening again. By combining these practices with effective use of digital tools, LTCs can create an environment where staff feel empowered to report incidents, ultimately leading to improved resident care and a safer workplace for all. Adequate staffing and training. So the right number of trained staff reduces stress and improves care. Ongoing education helps staff feel capable and confident. And implementing and enforcing staffing standards and prioritizing ongoing training and professional development ensures a higher quality of care for your residents. I can't tell you how many times you walk into a long-term care, SNF, nursing home, whatever you want to call, you can tell the ones where the staff are confident, that they've been trained well, they know their residents well, because they'll answer your questions. And it's not deceptive. It's not half answering the question. They will answer the question fully and completely, and they won't be scared of you. They won't be scared of surveyors. They won't be scared of anything because they know their residents well. And that's the way it should be. So last of these is emotional wellness. Do not forget about mental health. Offer access to counseling, employee assistance programs, and wellness resources to help manage stress and prevent that burnout. You can create a supportive, healthy environment where staff can thrive both personally and professionally. And again, you ultimately improve the quality of care for your residents, which is the ultimate goal. And if you're looking for more tools, OSHA's website is a fantastic resource for workplace health and safety and long-term care. At the end of the day, it all comes back to the residents. But here's the key. Your team can't take care of residents if they don't feel safe and cared for themselves. That's where we come in. At Qsource, we can help your staff hit the floor, fully trained, confident, and prepared to deliver top-tier care. Whether it's infection control, lifting protocols, or strategies to manage burnout, we've got the expertise to support your success. Well, that wraps up today's episode of the Qsource Podcast. Next time, we're diving into National Immunization Month, what it means for residents, staff, and how to stay compliant. You won't want to miss it. Thanks again for tuning in. Until next time, stay safe, stay informed, and take care of yourselves and each other.